Now, we want every patient that comes in here to get the best possible treatment that they can. And a lot of changes that are being made with insurance companies make that very difficult on the patient financially. We've seen copays go up. Some patients have $60 copays a visit, which is outrageous, especially if you're recommending they come 3 times a week. So I don't want the financial burden of what the patient's responsible for to limit their recovery here. A good reason for that would be that I don't want them to go back to the doctor after coming 3 visits, maybe once a week, and telling the doctor, you know what, therapy's not working, I'm not getting better. Well, they're not following what you had prescribed to them and how often that they needed to come. So what we had developed are financial programs to help that. So we have a couple different options for patients with high copays or deductibles. The first one is going to be a financial hardship. So any financially needy patient can take advantage of this. Anybody is more than welcome to apply. So it doesn't matter if you're not sure on their financial status or not, but it's definitely worth mentioning to them so that they can at least see what it's all about and look into it. So if you're a therapist or clinical staff treating them, even if they roll up in a Mercedes and have a lot of really nice jewelry on, I think that they'll still appreciate you saying, geez, you have a $40 copay, you're coming 3 times a week, that's a lot. Just to let you know, we do have financial programs to make that more affordable. So if you want to talk to the front desk about that, please go ahead. But what we'll do, so they'll fill out an application for it. They have to bring in some type of proof of what income they have. So whether that is a copy of a Social Security check, pay stub, bank account information, something like that, we have to prove that we legitimately looked into them being financially needy. And then from there, we can basically reduce their copay or whatever their patient responsibility is to make it affordable so they can come. Now, one stipulation on that is that I want that patient to come in the frequency you're recommending. So if a person comes in and they have a $20 copay per visit, they qualify for the financial program, and we reduce it so they're paying $10 a visit. I don't want them to okay, now I'm only going to come 2 times a week. They need to get better. I mean, that's the whole reason they're here. So if we're going to help them, they need to make sure they're following the instructions. And that should be addressed with them when they're filling out the application. Now, another option we have too is payment program. So they may not qualify for the financial hardship, but they still can't afford to pay $30 3 times a week. So what we'll do there is the therapist will estimate how many visits they think that they will need with us. So they may say, okay, I'd like to see you 12 visits 3 times a week for 4 weeks. And then what we'll do is space out what they're paying. So they can pay per month. So we can break it out to 6 months. So they're paying over that period of time instead of having to shell out $90 a week, which is a lot.